Hello, everyone. This is your partner in business and personal growth, FCPA John Mudany. Thank you for always tuning into this channel. Karibu, welcome. Thank you for listening to us. It's going to be another opportunity to discuss with Dr. Professor Mildred Mudany about child and mother health, focusing on breastfeeding and weaning. And now moving to some of the questions, I'll be asking Dr. a few questions today to clarify for us. And I believe that even you are free to subscribe to our channel, get alerts, and also you can send your questions and comments so that we can clarify them for you. Welcome, Dr. Please say hello to the audience.
Hello, viewers. I'm happy to be here again. It's always been a pleasure being able to share some of the information that I have as a pediatrician, as a mother. I always like sharing. So I'm happy to be here again to talk to us on some of the questions that may arise. Yeah.
Dr. To start us off, I know one of the questions that could be going on through the minds of the mothers out there and daddies, today's Father's Day, could be how long should a mother continue breastfeeding? I know that when I was a young boy, I was told that there's a guy who breastfed until he was 13 years old. How long should should mothers continue breastfeeding their children?
All right. The standard time that is in the guidelines is breastfeeding should go on for 24 months. That is 2 years. If a baby has 24 completed months of breastfeeding, that is the standard, that is in the guideline, and that is okay for the baby. But that may vary. Some mothers may continue beyond that. I think anything beyond that is a mutual agreement between mother and baby. And I know there are those who can continue up to even 5 years. The child goes to school, comes back, throws the bag down and gets onto the breast. That's an arrangement between them. But we want them to breastfeed for at least 24 months, except in certain special conditions that we may talk about.
Okay. My second question, Daktari, is if a mother conceives, because some mothers, last time we talked about mothers who get they conceive again, maybe within 1 year, or should they continue breastfeeding when they have conceived, or should they stop? Can a pregnant mother continue breastfeeding?
Largely yes, but with caution. The pregnant mother can actually continue breastfeeding, but depending on the stage of the pregnancy, there is the thought that breastfeeding when there is pregnancy can perhaps push a mother into perhaps earlier contractions. Remember the last time I was talking about breastfeeding, for those who listen to it, I said that the milk that causes, the hormone that causes what you call milk letdown, also causes contraction of the uterus. So depending on the stage of the pregnancy, there may be a little bit of challenge when a mother is breastfeeding. For example, towards the last age, perhaps it can cause contraction, perhaps it can cause a bit of stimulation, but we have not quite heard of cases of mothers who went into labor because they were breastfeeding. We quite haven't heard of that. So I would say largely yes, but with caution. Yeah.
So what would be a trigger? What would a mother do? So what you're saying that there's a bit of risk there? Did I pick that?
I think it is minimal. I think it is minimal. Maybe the obstetricians may tell us a little bit more, but I do know that mothers who conceive, like especially those who conceive and the babies are still very small, let them breastfeed the babies because the milk is still there. Yeah, because the other one who is coming in is still beginning to grow and it will take a long time. Yeah, so I think I would just say yes, they can breastfeed.
And there are mothers who will have 2 young babies. Maybe they get a baby after 2 years. So there's one baby who is 1 year old, another one who is 2 years old. Can a mother continue breastfeeding two children, two babies?
Oh yeah, I would say yes. I would say yes. If the mother has enough milk, yeah, it is okay. As long as you make sure the smaller baby has enough. Make sure the smaller baby who can only take breast milk has breastfed enough. The balance, the bigger child can actually take. After all, normally when a baby is breastfeeding on one side, there is milk that is flowing freely on the other side. I remember some of my babies used to come even with cups. And when I'm breastfeeding here and the other one is flowing, the other one comes with a cup. and gets the other milk that is flowing freely and drinks. So it is actually okay, and there is nothing wrong. So the mother herself, knowing that she's perhaps breastfeeding more than one baby, should make sure she feeds enough. She takes enough fluids and she feeds well. She has a balanced diet. She has her fruits and she drinks plenty. Then she'll have enough to actually breastfeed the two babies. And it is okay. Like I remember, indeed, in our own case, we had our firstborn and then the secondborn came 2 years down, 2 years, 3 months. But this secondborn baby did not like breast milk too much. So I would let the baby breastfeed, but put that baby down, and the next one would just come and clear and help me clear the breast so that I don't have engorgement. So there is nothing wrong with that. You can breastfeed two babies.
And then there are some mothers who feel a lot of pain when their breasts are, the nipples are painful, and or it's cut a bit. How do they help? Because that can be very discouraging.
Yeah.
Also psychological, can make them to maybe to lose milk. What do they do?
There are various reasons why there would be pain when a baby is breastfeeding, but perhaps among the commonest is if you have cracked nipples. Sometimes mothers, and really the young mothers, maybe those who are doing it for the first time, the nipples may be cracked. So when the baby is breastfeeding on them, there's a lot of pain. So there is something out there that you'll get at the chemist or the doctors will give you, some lanolin, some kind of ghee, something that can be applied that kind of brings some healing to those breasts, those nipples that are cracked. And that would be helpful. And that can be applied off the breastfeeding time. So after the baby has breastfed, between this time and the next one, you apply that and it helps, and that eases out the pain that would be there. The other reason why mothers would feel pain is if there is engorgement of the breast. Now that can cause a lot of pain when the baby is feeding and even when the baby is not feeding. And when there's that engorgement, then there's need to use some anti-inflammatory. There is sometimes it is due to infection. There may be, it's actually necessary to go to the hospital and just see, is it an infection or what is causing that breast engorgement with pain. Sometimes they tell you to use some warm water to kind of express the milk out, but using anti-inflammatory is helpful because it is very, very painful. And if it is an infection, then you actually need to go to hospital and get some antibiotic and get your review. Yeah.
Okay. And then what about mothers? Some mothers have got special conditions. There could be some sickness, or they have got certain infections, and normally people fear that maybe maybe they cannot breastfeed. What do they do during these periods? Those special mothers that are going through some conditions, like now with corona and maybe others like HIV. How do you handle these situations?
All right. There are guidelines that help us with those special conditions. They are actually guidelines. So for example, there are guidelines that tell us what to do in the situation, for example, where a mother has got HIV. So there are guidelines that are used, and the guidelines states for our country, and I think this is how it is. The guideline states that either way, you do exclusive breastfeeding. That is the guideline that we have. Even in mothers who are HIV positive, we do exclusive breastfeeding for 6 months and thereafter move on to other feeds. But the caveat here is the mother must be taking antiretroviral treatment. Yeah, because when they start, now in Kenya, we have the test and treat. If you test a mother or anyone and find them positive, you start them on treatment right away. So the pregnant mothers, if they come to the antenatal clinic and they are tested and they are positive, they should right away start on antiretroviral treatment. Now, when the mother starts on antiretroviral treatment, from the time she starts coming, by the time she's delivering, perhaps the viral load is significantly down, and the baby can safely breastfeed. But the mother must continue on antiretroviral treatment, and even for the baby, there are certain guidelines of what they should be on in terms of treatment from the time that they are born. So even for the HIV positive mothers, the guidance is exclusive breastfeeding for the first 6 months, and then they move on. The only difference is now the duration, how long they breastfeed. I've just told you for the other mothers who don't have maybe other infections like that, the duration is 24 months. For the mothers who are HIV positive, they are advised to stop breastfeeding by 1 year. Unless the guidelines have changed, that is what it has been. Yeah, but guidelines also are moving targets. So perhaps that could have changed by now, but that is what it was, I think, the last time I checked. Yeah. Yeah.
Then there's this category of mothers who don't have enough milk. Does the size of the breast determine how much milk? And if a mother has very little milk, what can they do to make sure that they have milk?
Now, the size of the breast has nothing to do with the amount of milk. All breasts should be able to produce milk. And those women with bigger breasts, it doesn't mean that they have more milk. And those with smaller breasts, it doesn't mean they have less milk. All mothers actually can have enough milk, but that also depends on a lot of things. How are they feeding themselves? How much are they drinking themselves? What is the psychological status? By the way, the psychological status can affect the flow of milk in mothers. Mothers who are very, very stressed, the milk could go down. Mothers who are not feeding as well, the milk could go down. But otherwise, all mothers are supposed to have enough breast milk. By the way, even mothers in the famine-stricken lands have enough breast milk for their babies. So I think a lot of it is in what the mother herself takes and the status of her mind.
And then just as we finish, and there are mothers out there that have got special children, special needs children. That's the reality of life, and our hearts go to those mothers that are going through very tough times. What's your advice to those mothers as far as this? How do they handle this situation?
Well, I'm not sure whether the special needs here means maybe the baby cannot breastfeed.
Yes, could be.
Yeah. There are babies who are born.
Or autistic,
and
or other
the babies have certain challenges right from birth. And I'm thinking about babies even who have what we call birth asphyxia. Babies who are born and at that time they're not able to get enough oxygen, maybe because they stayed perhaps too long, or there's something that happened and they are not able to have enough breathing, and when they are born they actually are not breathing and they're resuscitated for a while. Some of them take too long to pick up, even in things like breastfeeding or feeding altogether. Some of those babies need some special help. Some of them need to be helped by occupational therapists. Some of them just need to be helped by the nurses who have learned how to deal with those kind of situations, or specialists on children who are autistic and all that. So the special needs children need some special care. Yeah, so they're not lumped in the same category with all other children, because they need somebody to work with them, to support them until they're able to get there. Yeah.
Thank you so much, Dr. Do you have any closing remarks? Anything you want to say?
Yeah, I guess what I want to say is that let us embrace breastfeeding for all the babies. Actually, whatever condition, let us breastfeed the babies, and mothers be encouraged to do exclusive breastfeeding for the first 6 months. And when you get to weaning, I think we produced another article on weaning. You can look at that and do that well. And
what is it titled? What is it called?
Weaning. The other one is just called weaning.
By who?
Yeah. Well, I'm just talking about the lesson that I gave a little earlier than this. Yeah, so that you wean the babies appropriately, you breastfeed them for a total of 24 months, and enjoy fellowship with your children. Enjoy the babies when they are young. It's a special stage. They take quite a bit of time, but they are also very exciting, and they are lovely. They are a blessing. So connect with them and use that opportunity to just fellowship with them as you breastfeed them. You will have wonderful children that will grow up into wonderful people and wonderful citizens in this country. Yeah, thank you.
Daktari, asante sana. Thank you very, very much. This has been awesome. It really eye-opening lesson on how to support the children, the mothers out there. I'm sure you've learned a lot, the fathers. I would have asked you, should fathers breastfeed? Because some fathers in some countries also breastfeed, but that's for another day. Thank you so much. I appreciate that. And you is out there, please watch out for the next episode on this series and on this channel. This has been your partner in business and personal growth, FCPA John Mudany, saying thank you so much. Please remember to subscribe. Press subscribe my YouTube channel. You can also find me in Instagram under John Mudany. You can find me in LinkedIn under John Mudany. You can also find me in Facebook under John Mudany. You're welcome. Please post your question, like the page, whatever you want us to work together. It's all meant to make us better. It's been your partner in business and personal growth, talking to Dr. Professor Mildred Mudany, consultant pediatrician and a PhD holder in tropical medicine, focusing on children the CEO of Help Reach Africa, and also member and chair of council of KISS University, talking to us on this series. I say thank you, Dr. Ari, for taking your time. Asante sana, and God bless you. And we say thank you, and bye-bye, bye-bye, bye-bye,
Bye-bye.
bye-bye. Asante sana, that was good.
Thank you.
Thank you so much. Thank you.